Acupuncture and Chinese medicine can help pregnant women so very much, especially in the third trimester. As the women are getting closer and getting ready to give birth, there's a lot of things going on. Oftentimes, there's lots of aches and pains, from pelvic pain to low back pain, hip pain, neck pain, and acupuncture can easily resolve or decrease any person's pain. So another thing we see is a lot of stress and anxiety, and that's common as we're going through all the changes that are about to occur, giving birth, the changes in the family dynamic, how am I going to work? All these things can be really stressful. So again, getting acupuncture helps to turn down the volume of that stress. To take that time out for self-care is just a really beautiful thing. So a lot of people come to me for a breech baby. And if the baby is breech, it just means the head is not down, kind of locked and loaded, ready for labor and birth. So the baby could be side lying, or the baby could be butt first, where the head is up instead of down. So either of those choices, if the baby is in a wrong breech position, then it is also an automatic C-section. So most women really are trying to avoid having major abdominal surgery for their birth, if at all possible. So it's nice to provide an option. And what I would do is I do acupuncture and moxibustion, and there's a 10-day protocol for moxibustion. So most times I will see a woman 1, 2, 3 times during that 10-day period, but then she's going to take the moxa sticks home, and her partner are going to do moxa on her to help with that breech baby. So we have about an 80% success rate in our clinic with the mob position babies and treating women with acupuncture and moxibustion. So it's just really great to have another option. Some of the other things that we see in the last trimester is people wanting to get ready for their birth. And so we call that labor preparation. So typically labor preparation treatments would begin weekly around week 34. And what we're doing is we're calming the mind. We're turning on the right hormones in the body. We are relaxing the sinews, relaxing the joints, the muscles, the tissues. So it's really, really nice. And it's helping the mom and the baby to get ready for the big day. So then we talk about natural promotion of labor. So that would be once you are full term, which in California, it's considered 38 weeks. So at 38 weeks, we can do the points that are contraindicated in pregnancy because they help bring on labor. So I never say I'm inducing a woman. I call it natural promotion of labor. We are naturally stimulating the hormones and getting her body to softly, gently open up. This is not Pitocin. It's not going to shock them. Her water's not going to break on my table. It never has. I mean, if it does, that person gets the lucky winner or whatever, but it's a risk I take treating this demographic. So it often takes some time for the body to unwind. So some women will come and see me, once a week starting at 34 weeks. And some people I don't see till later in the pregnancy. So once you hit 38 weeks, I'm going to recommend at least twice a week. Some people will come every other day. And especially as you get closer to that due date or that end date. So in the state of California, our due dates are on week 40, but we are allowed to go up to 42 weeks with all of the liability issues. So the doctors want you to give birth by 42 weeks or risks increase. So there's a lot of women coming to me in the 41st week. So I would highly, highly encourage you to start coming earlier and do not wait until the last minute. Some people have been lucky enough to have a one and done kind of treatment where you do the acupuncture, I do the acupuncture, and the next day I get a picture of this cute little baby in their arms. So that's always amazing when it works, but I would definitely think about or encourage you to think about getting at least, a series of treatments, 4 to 6 to 8 treatments to help your body unwind and open naturally. And so some of our patients have also been reporting shorter labors and births. So whether it's a shorter time of the actual labor, shorter pushing time, or shorter total time. So I feel like that is a bonus of Chinese medicine, getting acupuncture for your third trimester during pregnancy.